Hi, friends. Welcome one more time to the information session with Dr. Lizbeth Mendoza. I am Carla Colin from the Latino Chamber of Commerce. I am new here and I am so happy to be here again with Dr. Lizbeth. We've worked together in the past and we are going to give you updates about COVID and vaccination. So welcome, Dr. Lizbeth.
Hi, Carla. So nice to see you here again. It's been a while, huh?
I know. It's been a little bit.
And it's always a pleasure to work with you.
Of course, yeah, likewise. So thank you so much again for being here. We're gonna talk about the updates on COVID, the numbers that we've seen in the county lately. I know numbers have changed, so we want to hear what's going on.
Yes, sure. We always have good news, better news, and some goods that are not so good. But you know, we're feeling good. We're feeling good. So I think it's important to know our county, Boulder County, remains still in a high transmission state, or in a high transmission that we call red, according to the CDC tracker. So, and this is not just us; is most of the state is in the same situation. The 1 week cumulative incidence rate, according to the data this past week, was 147 cases per 100,000 people in the last, along the 7 days, which is lower because the week before was 273. So that's encouraging. That feels good. Nevertheless, the cases are still so high that we continue to have a backlog at the state level in the cases. Therefore, we don't have really a lot of data related to demographics among the cases. Well, so this improvement was, or this decrease was seen across all the age groups. Nevertheless, the cases where we had the highest rates were among those people between 23 and 44 years old, and also the little ones, those under 11 and under. So yeah, we still need to be very careful with these groups. The testing positivity rate was only 5%, almost 5%, which is a really good, a really good improvement in the sense that the last week or the week previous to the last was 10%. So there was an improvement there. Also, the hospitalization was reduced, but still we see how the healthcare services are really struggling to cover all the demands that people are having for COVID or not COVID. So we gotta be very patient and understand that our services are still very, very overloaded. Well, so in terms of hospitalization, we had about 25 people in the week before February 22nd that were hospitalized with COVID in our county. And that's a little lower than the week previous, that was 30. In the case of the kids, well, so the hospitals, the children's hospitals in our state, the report for us, for all of us, they reported 13 cases of kids hospitalized with confirmed COVID, but they also had another 21 that they were still under investigation. So this is still a number that we need to be very aware of. And mostly, I really, really want to make it, kind of like very visual for the people, that over half of these cases among little ones are the smallest ones, those under 4 years old. These are, half of those cases were under 4 years old. Remember that these kids are still waiting to get their vaccine approved. So let's be very careful for them, because now we're seeing how the proportion of these kids or these cases belong to this age group, meaning they are more vulnerable because they don't have their vaccine yet.
Of course, yeah, and it's always the ones that cannot, get vaccinated yet. So what can we do to protect them?
Yes, thank you for asking that. So yeah, so well, what can we offer to them? The parents ask us all the time, and they really want to know. So well, for sure, one protection is us being protected. If we don't get sick, then it's going to be less possible that they get sick, right? So, and how do we do that? So we want to stay still with, comply with our vaccine schedules, complete our vaccination schedules, get our boosters, try to stay away from crowds where it's more possible that you can find somebody distributing the virus, and then you bring it home. Even if you don't get sick because you're vaccinated, or you don't get severely ill because you're vaccinated, you can still transmit the virus to the little one who has no protection of the vaccine at all. Masking is still, even when the mandates were lifted, just try to think about, these little ones. You might be, young and strong and all protected, or might not even have kids, but, just think about these little ones and the stress that the parents are going through, because they are very vulnerable. So just mask if you're near to kids, in a public area, mostly if the public event that you're attending is in a closed space, or if you're going to the store. Just think about these little ones that don't have the protection. And this extends to the people who have immunocompromised, meaning that their immune systems are weak. The same, let's think about them. Those that haven't been able to get vaccinated because they have some allergy or some condition that, doesn't allow them to get vaccinated, or those who have been vaccinated, but their immune system is so weak that they develop a not so strong response. So still, just remember all those contention measurements that we used in the beginning when we didn't have a vaccine, and we know they worked. Continue using your mask, continue your distance with the people, try to avoid crowds, mostly around the kiddos. I think that's one of the most important things that we have to remember.
Yeah, of course, and it's always up to us, because they don't have a saying on how they feel, and especially when you mention kids 4 years old and younger, I think about my niece and nephew. They're babies, they're, one of them is 2, the other one is 7 months, and they cannot tell us if they're feeling sick. It's hard for them to tell us if they don't feel good. So it's up to the adults to take care of them.
Yes, exactly. And also, because of their age, they might be expressing the disease in a different way too. We have to consider that. So we might be in the presence of a kid who's sick, and we don't know that that kid is, producing viruses, because poor thing, he got sick. Yeah. And then we go ahead and take it to somebody else in our family, or, other kids in our family or in the community. So yeah, let's be very considerate of the little ones and the people with immune systems that are weakened.
Yeah. Okay, thank you for that. And what about vaccinations? What's the update on that?
Yeah, so that's a little more bright, the scenario, because we are seeing more and more people getting their first dose of vaccine. We always celebrate when we see somebody walking in and saying, I'm gonna get my first dose. Really, we want to party. It just feels so good to hear that somebody that was not able to get vaccinated before, for whatever reason, now is getting their first dose. And we had, like, the last week, there were about 1,572 people that went to get their first dose. And then the week before, there was a lot of, again, a bunch of them too. Actually, the week before, that was when we had the 1,572, and the last week we had 1,386. We are thankful to each one of you guys doing that. And with this, we know that at this point, over 300,000 people in Boulder, residents in Boulder, have received at least one dose. So they're not complete. They might not be completely vaccinated, or yes, but at least they have received one dose. And that's 93% of the total population. That's pretty good. We're in a good path. Now we have almost 230,000 people in Boulder County that are fully vaccinated. They already completed their schedules, and that's almost 70% of the population. That is so great. We don't see that in all counties. This is going really, really well. Again, thanks to all these people that have been going to get their vaccines, making sure they get their second dose, and getting their boosters too. That's the other thing. Don't forget your booster is there for you. And also we're very thankful to all the people, like your organizations, that have been helping to bring the vaccines to people. who have a difficulty accessing to them. Still, we need to, acknowledge that there's people who are eligible to get their vaccine, but they are not vaccinated for whatever reason. And we really want to know what's going on and help them access whatever you need to be able to get your vaccine. For some people, the difficulty is that they don't have access to a healthcare provider or somebody in the healthcare field or in the scientific field that they trust, that they can ask questions from them and then receive the trustworthy information that is really backed up by the evidence in science and in medicine. And if that is the case, please communicate with our Boulder County Public Health system, and ask the questions that you need to ask. Don't feel ashamed. No question is stupid. Ask any question that you have. If you have heard things, rumors that are like kind of strange, or they're kind of like making you buzz in your head and saying, oh no, I don't want to get vaccinated because I heard from somebody this and that, or I read in social media. Just ask us, and we will provide you with whatever evidence that you need so that you can ponder what is your risk and benefit of getting vaccinated. For some people, is also the lack of access to information in your language. So also let us know, and we'll make sure to find you the sources that you need in your language. For some people, the problem is that they have way too much in their life going on. And this of trying to get an appointment or trying to attend a clinic is just too much. That's the case. Again, communicate with us, and we will be very happy to help you find an appointment that fits your schedule, that fits your lifestyle, to make sure that you get this protection. For some people, it might be that they have a problem with transportation. There's also a system to help people get transportation to the vaccine sites and from the vaccine sites. So please get in contact with us. Remember that you don't need to have insurance. You don't need to pay for this at all. So just vaccines are there and everywhere. So please just contact us, and we're here to help you get the vaccine.
Of course, thank you so much. And just as a little reminder for our audience, and I'm going to put all this information on the description of the video so that you don't have to be, listening to the whole thing or going back and forth to catch the information. I'm going to put everything on the description. But we also have a vaccination clinic on Saturday, March 5th, which is amazing because if we work Monday through Friday and we have a little bit of time on Saturday, we can do that. And then if we have Sunday off and the vaccine makes us feel a little goofy, a little sick, then we have time to rest. And I think it would be nice to mention that a lot of employers are letting people, get vaccinated and have the next day off in case you work, because they understand that, you can feel a little sick. So if you come on Saturday, March 5th, we're going to have it at Front Range Community College in Longmont. We'll see you there. You'll be able to get your vaccine, your first dose, second dose, booster, or your flu vaccine. And also we're going to have tacos and music. So what else can you ask for? We're going to have a whole community party there. Obviously, we're going to take the necessary precautions. And if it's your first vaccine and you're there just for the first time, just wear a mask, keep social distance so we can all feel safe. But yeah, come see us on the 5th. Like I said, I'm going to put all the information there. And we'll be there. And I know we've mentioned before about the other places offering the $100 gift card after you get your second dose.
Yes, exactly. So we have a permanent clinic at the Longmont Hub in San Brain Hub. And this clinic offers a $100 gift card to all those that complete their schedule of vaccination COVID. So that means the second dose for Moderna and Pfizer, or their dose with J&J. If you go there and get your first dose, they will take your name and your information. And then when you return to get your second dose, that's when you will be receiving your card, your gift card, $100. We also offer the influenza vaccines because, we know a lot of people at this point need needed for the school or for work, or just because they want to be safe also from influenza, the flu vaccine. But we also have a clinic, a permanent clinic that is at the fairgrounds, and this is a drive-through clinic. We don't have the $100 gift card in that one, but it's a super comfortable clinic. It's open every single day, even Saturdays and Sundays, and from 8 to 6 p.m. And it's a drive-through. You don't even have to get off your car. You can find all the information about how to register for this clinic, but you don't even have to show up with an appointment. You can just show up. The same with the clinic in San Brain. Walk-ins are more than welcome. And so, yeah, so you can come to any of these clinics and get vaccinated. For your comfort in these clinics, we always say, well, why don't you just pre-register? Because we have a link for pre-registration that you can see in our website, so that you don't have to wait to do the whole thing. You just show up. You're already there in the list because you pre-registered. All the information needed is already there. Go ahead and get your dose in there. I want to also mention that this clinic in the hub, the Longmont hub, is very nice because they schedule your second dose too. So it's not like, you get vaccinated and bye, see you the next time. No, they also find you your second dose appointment. So that way you make sure that you show up for your second appointment and you have a spot for that. So yeah, there's a lot of information on our website. If you feel like, well, I want to get vaccinated today, right now, well, go drive a little bit to get your vaccine today, right now, at the fairgrounds, and you'll get it. I can assure you'll get it. But if you feel like going other places, please check our website. There's so many people, so many organizations, so many businesses helping to bring vaccines to people, that really nowadays you can find a clinic super close to you, even walking distance. So, and if you don't, then there is a phone number in our website as well, where you can call to get transportation.
That sounds great. Thank you so much. And one last thing that I want to talk about is about the rapid tests. I know some people have ordered them and it takes a little while to get them home, or maybe they only qualify for certain amounts. How do we access to more of these rapid COVID tests?
Yeah, so this is great. Yeah, more and more we're getting, organizations that distribute these tests. They became kind of like providers or distributors of these rapid tests. And at this point, we know, and then of course there are more of them, but we know that our Boulder County, Centro Amistad, and the Center for People with Disabilities are already distributing them, or will very soon receive their batch to distribute them. You don't need, you just show up and pick them up. You don't need to fill a form. And this is why this is happening, because for a lot of people getting into the internet and completing the form, it's kind of like a bummer. For one thing, or they may not have access to internet, they may not understand how to do it, they just don't like to do it online. Fine, they just show up and pick up your test there. But other reason is because some of the families that live with a lot of members in the same house, then they might not have enough with 5 tests or whatever they give you when you enroll online. So they might need more. Well, then you just show up to any of these providers and then you get the extra tests that you need. But yeah, this is happening. And if you have an organization that would like to become a distributor of these tests, please get in contact with us and we'll help you connect.
That is great. Thank you so much. Is there anything else that you want to add? Is there any other information that you need us to know?
Yeah, maybe I just want to mention there's something interesting in the observation about the vaccines, and this is important for us to work together as a community. So most of the adults over 30 years old, they, more than 70%, more than 74% of them have been already completing their vaccination schedule. So these groups of age are in a really good place. They're really, really well covered. Nevertheless, where we see very low uptake in the vaccine is in those young adults, 18 to 19, and those 20 to 29. And we really want to help you guys to access your vaccine. We are not sure what is stopping you from getting it, but whatever it is, please feel free to contact us. We really understand that there's a lot of things going on in life for a lot of people, and this is just one more bummer, right? One more thing to do, and we really get it. So if we can help you with that, be assured that we will. We will help you get an appointment. We will help you find a clinic nearby, whatever it takes, because we really want you to be protected. If you have questions, if you have doubts because you have heard things or seen things that seem kind of fishy on the internet, because there's a lot of misinformation and disinformation out there in social media, please contact us. There is nothing wrong with calling and asking, hey, is it true that the vaccine killed people? And then we can tell you what the science, what the research in medicine and science has to say about that. What are the things that we're seeing? You're worried about side effects, fertility, things of that sort, please contact us so that we can show you how this is not something that you need to worry about, really. It's more important to worry about the long COVID, all the complications that come with COVID and the risk of death in COVID. So please contact us. The same with parents. If you parents are having doubts because you feel like the vaccine, may pose more of a risk than getting sick, please give us the opportunity to show you how that is not true. Be careful with information that you pay attention to when you are deciding this super important thing, this super important event that is getting protected against the virus that causes the COVID.
Thank you so much. Yeah, we were talking about how all of the resources that were used to develop these vaccines were put in place so fast that sometimes it's hard to believe that it's true. It didn't appear like magic. It took a lot of effort, a lot of energy, a lot of people, a lot of scientists working on these. And unfortunately, this has become like a political topic, and that's not the case. This is social. This is to support one another. This is being a good human being and support your community. So forget about the politicals, forget about that. Just focus and ask the questions to the right people and from the right sources. Because social media kind of blurs the whole purpose of these, and involving politics or religions is not the right way to get the information.
That's exactly right. So please stay in touch. We're super happy to hear anything that you have to ask or say. And there's at this point, we have heard so much. There's so much going on that is like, most probably the question that you have, we already know. Yeah, we already heard of it, and we already, we already have the evidence that shows, that demonstrate that is not true. That is just a political situation. And we are not here for the politics. We're here for the health of the community.
Of course, like always. Thank you so much, Dr. Lizbeth Mendoza. And I will post your information and the website so people can refer to it if they have any questions.
Thank you, Carla.
See you next time.
See you. Bye-bye.
Bye.